It's amazing that we now have this technology that we can disinfect with something so powerful, or a little unit that can throw out amazing wavelengths of light. We actually have the Photona laser in our office, and this is us at our training, having a little fun there. There's all different types of lasers out there. See, Photona has both the YAG and erbium. There's CO2. Really, CO2 is not that prevalent in dentistry. Diode, a lot of hygienists use the diode laser for bacterial reduction, and the periolase. The good thing about the Photona is it has both the YAG, so you can do the different types of procedures, and then the erbium, and depending on what you're doing. I used to be a general dentist for a long time, and one of my favorite things for the erbium laser was veneer removal. You just put it along the veneer, and oh my God, it comes off. It's like, that was the hardest thing to do. There's so many ways to use these lasers, and it just depends on, there's different price ranges. What's the difference between the lasers? It's basically a wavelength. We're just working with light. So how do they work? It's a focused beam of light, the energy sent to the tissue, and depending on what we're performing, we'll use a different type of laser light. And so we can be cutting, reshaping, cleaning, removing calculus. And if you're doing some restorative, you can, as I said, remove crowns, veneers, and it definitely helps speed up healing and helps with regeneration. Just today, as one implant that I had done an immediate implant on, I deal with a lot of holistic patients, so they wanted their own bone, and working with your own bone is not always the easiest, especially doing an immediate implant. I ended up treating it with the Photona, and surprisingly, it was like 8mm defects around it, and they've actually closed up. And so it's amazing what it can do. They have the twin light protocol. Every laser has its advantages, disadvantages, and you're going to be spending for something like a Photona. You can be having a really nice sports car if you want, but instead you just have this big thing in your office. This patient I saw, and they were having this red area around this crown, and we couldn't figure out what was going on. The dentist wanted to fix that and didn't understand why this is happening. The margins were fine. There was no cement under there, and no resolution for months. After treatment with the laser, you can see how much it improved the look at the gum lines. It's amazing what a little bit of light can do, even treating periimplantitis.